Hello, everybody. Today we're going to do a lesson on outbreaks, epidemics, and pandemics. I'm Jordan, and I'm going to be guiding you through this today, and the example we're going to go with is a disease called cholera. Right off the bat, let's try to define what the word epidemic means. So the Centers for Disease Control, the CDC, defines an epidemic as, quote, an increase, often sudden, in the number of cases of a disease above what is normally expected in that population in that area. So we have to see an increase. It has to be above what's normally expected. So there's always a baseline for every disease. Um, there's a background rate of how many people get it, and we kind of know that by taking data over periods of time, like months and years, and we have to take into account which populations are getting infected. So some diseases affect certain populations differently. So, for example, you might have a disease that affects women more than men, or a disease that affects people who are poor more than it affects people who are rich and have good health care. So all of these factors need to be taken into account when we use the word epidemic. So now I'm going to tell you a story. It's the story of a man named Dr. Jon Snow. Jon Snow was a physician. He worked in London in the mid-1800s. Around 1854, he noticed, and some other public health officials noticed, that a lot of people in London were getting a severe illness. What was the illness? They were getting abdominal pain, diarrhea, and vomiting. And this is classic cholera. People knew what cholera was at this point in time, but they didn't know what caused it. They knew the symptoms of cholera. They knew that cholera could be deadly, but the current state of affairs with cholera was that it was caused by something called bad air or miasma. And physicians believed this. This was really the theory on what caused cholera at this point in time. So, jumping ahead a bit, let's talk about what cholera even is. So, nowadays we know that cholera is a disease caused by a bacterium, a species of bacteria called Vibrio cholerae. In the wild, Vibrio cholerae lives on the shells of crustaceans such as crabs, shrimp, and lobsters. It usually lives in salt water or slightly salty water, which we call brackish water. After Vibrio cholerae infects a person, it can be transmitted through human waste, human feces. And after it leaves a human through their feces, it can live in water that's then been contaminated by that sewage. And cholera has caused outbreaks for centuries to millennia. It's a very old disease that has often caused pretty severe epidemics in cities, mostly places where the water is close. The drinking water is close to places where human waste is let out into the environment. Back to Dr. Snow. Dr. Snow did not buy this bad air theory because there was no evidence for it. What he did instead is he went out into the community and he documented the sick. And we see this at the right side of the screen here. This is a graph of the number of cholera deaths in London in 1854 during the cholera outbreak. And this is based on Dr. Snow's data. And we can also see that it highlights month by month how it changed. And of course, these are backwards if you're American. Usually we put the month first, but this has the day first and then the month. So keep that in mind. So this is his data. He went out and counted the number of cholera cases and where those cases were located. And he noticed a pattern. Dr. Snow realized that the cholera cases were clustered around this area, which is around a street called Broad Street. Specifically, it was near a water pump on Broad Street. And most people nearby used that pump to get their water, which they then brought home with them to use for all sorts of purposes, including cooking and drinking. So next, Snow asked the people who had been affected by cholera where they had gotten their water, because he already had a hunch that it possibly came from this water source. And sure enough, most people who got sick said that they used the Broad Street water pump. So it all made sense to him at this point. He asked the question then, if people caught cholera from bad air, like the other physicians were saying, why were there people who lived in the same building as those who got sick, and yet they never got sick? So he asked these people, where do you get your water? And a lot of them said that they got their drinking water from a different pump. So now Dr. Snow felt like he knew what was going on. He knew that with this information, he had to ask. He had to tell someone and make this known to the public, or else more people were going to catch this horrible disease, this horrible cholera. And he approached the town council in London and asked them to take the handle off the water pump. If the handle is taken off the water pump, then nobody can use it. So he presented his data to the council, and at first he was met with a lot of skepticism, but he persisted. And eventually they decided that his data was convincing, and they agreed to remove the handle from the water pump. This single action is credited with ending the 1854 cholera epidemic around Broad Street. So what does this teach us? This teaches us that when we notice more cases of a disease than usual in a particular area, among a particular population, this is called an epidemic. Outbreaks and epidemics always have a cause, even if we can't spot that cause at first, or people don't believe in the cause. So let's use this example again to see how Dr. Snow found the cause. He used two techniques. The first technique was information gathering. He went out into the community and asked people questions like, who have you been in contact with in the week before you got cholera? Where did you eat? Did you eat at any restaurants? Where did you get your water? Which turned out to be the important question. He also engaged in critical thinking once he got that information and those facts from the people he interviewed that had gotten sick, and from the people who did not get sick. When he realized that the common factor between the people who got sick with cholera was the pump, he looked at where the cases were located. And he knew that most of these people reported drinking the water from that pump, and that most of the cases were on the street that this pump was on. Among people who lived on that street but didn't get sick, those people usually didn't use the pump. So this is great, but how does it relate to the current pandemic that we all have heard so much about in 2020? So this is a comparison, two columns in which I compared them. So the 1854 epidemic was caused by a bacterium called Vibrio cholerae, like I said. But COVID-19, the disease caused by this virus, is caused by a virus. It's not caused by a bacterium. Cholera can be passed from person to person through feces, but COVID-19 is passed person to person through air droplets, like from coughing, sneezing, or talking and spitting. For the cholera epidemic, the source was the Broad Street pump. And for COVID-19, the source is currently thought to be a seafood market in Wuhan, China, that also sold live animals. The 1854 cholera epidemic was stopped by telling people not to drink the contaminated water and then removing the handle on the pump. But COVID-19 ended up, as we know, spreading worldwide and becoming one of the biggest pandemics. So why did COVID-19 become such a problem when the cholera epidemic was stopped so quickly? The reason mostly is because nowadays we live in a world in which people travel a lot. In 1854, not a lot of people were traveling while sick out of London to other countries. But nowadays it happens every single day. So if someone gets sick with a virus in China, then it can be transmitted all across the world in less than 24 hours. And the specific virus that causes COVID 19 is actually quite contagious, whereas Vibrio cholerae can only be passed through feces, so you have to usually drink contaminated water to catch it. This begs the question now, how do you protect yourself from the current pandemic? Well, there's actually a lot you can do. The first thing that the CDC recommends is staying at least 6 feet away from other people. And the next thing is don't gather in groups. Stay out of crowded places and avoid mass gatherings like concerts or movies, even if your state ends up allowing this. Avoid it for a little while until we see that the number of cases of COVID 19 goes down to a level in which we can manage. Wash your hands frequently. If you must go out, wear a protective mask over your nose and mouth to protect your airway. And if someone in your house becomes sick with COVID 19, stay in a different room and make a plan to minimize the amount of contact between you two. I hope this taught you what an epidemic was, and I hope it gave you some insights into how to use critical thinking to figure out what caused an epidemic, and then also how to take that cause and figure out how to stop it at its source. Here are some sources I consulted. All right, everyone. Have a wonderful day, and don't get sick.